Okay, this is a startling statistic, but every hour, one American dies from melanoma. That's really, I mean, you hear that, and I think your attention is grabbed.
Yes, and there's some groundbreaking technology that we're going to be talking about. It's called MelaFind, and joining us is Dr. Lydia Parker, who's a dermatologist at the Parker Clinic. Doctor, thank you so much for coming on again.
Hi, doctor.
Thank you.
Nice to see you.
Okay, first off, we talk about melanoma. What's the exact definition of melanoma?
Melanoma is a cancer of the pigment-producing cells in our skin, and they're really stimulated by tanning, sunburns, sun exposure.
Okay, now until now, how did it used to be diagnosed? How did you find it?
Well, when you saw a mole that looked black, irregular, changing, bleeding, you would biopsy it. You know, you get a shot of Novocaine, you cut it out, you send it to the lab, you get a couple stitches, you wait a week or so for the report to come in.
Okay.
All right, now let's talk about MelaFind. This is the groundbreaking technology. How does it find the melanoma?
One click of a button, like getting your picture taken, and in a minute you have a report.
Really?
It's quick, it's easy.
We're seeing some of the video
painless.
here.
Yes, yes, just like taking a digital picture, but MelaFind is using 10 wavelengths of light, looking deep into the skin, getting a 3D image. One click of the button, you wait a minute for the report. It's analyzing 75 features of the mole. Wow. Instant results.
So there's no pain or discomfort?
Not at all, like getting your picture taken.
And before we came on, I was telling you, I didn't have any moles until I went to Florida for the first time. For 2 years straight, got really bad sun poisoning. Now I have them all over. And now, if there's multiple moles in one area and can it actually look at all of them, or does it have to concentrate on one mole?
We're taking a picture of one mole at a time. Just one click on each mole. Not that we need to do MelaFind on every mole, just the ones that look questionable or suspicious. If a mole looks perfectly fine, you don't need to do MelaFind on it.
Yeah.
If it looks like it's definitely melanoma, just have it removed. But you know, there are those questionable moles. They don't look perfectly normal. You're kind of suspicious of them. You're not sure. You would normally need to cut them out to find out, and now we can get an instant result.
Wow. And early detection is so important, obviously.
Melanoma is completely curable if you catch it early, but of course it's fatal if you catch it late.
Yeah.
Leading cause of cancer in women in their 20s.
You're kidding
And
me.
rates are doubling.
Right.
High
Is that
school
because
girls, teenagers.
they're not coming in to get the early detection?
Right. And you know, who thinks a girl in her teens, a girl in college, they're getting melanomas more and more from tanning beds.
And it's just, could you not have a family history of cancer and still get this? Because, you know, especially the young people out there, they're like, oh, I don't have any cancer in my family. It's okay. I'm not going to get melanoma. That's sort of, for whatever reason, that's the last cancer people think about when they're going out and they're doing the tanning, or when in Northeast Ohio, when we finally get that sun, we want to bathe.
Everyone's out there, and one bad sunburn really increases your risk. It's the second most common type of cancer in teenage girls.
How do we protect ourselves?
Don't go to tanning beds.
That's the no-no.
No outdoor tanning. Sunblock for that unavoidable sun exposure, and having your moles checked once a year.
Yeah, I mean, and are certain skin types more prone to this?
Absolutely. No one's immune.
Okay.
So don't think because you're Italian or because you have darker skin, don't think you're immune.
Right.
But certainly those fairer Irish skin types are the most prone.
Okay.
And lastly, doctor, if you do find melanoma, let's talk about the treatments and the success rates.
You know, melanoma is so curable if you catch it early. You have it removed, you have a few stitches, you have a little scar, but you're okay. The problem is when someone delays going to the doctor, or they just didn't realize that black mole was growing and changing on their back. That's why you want to get it checked. You can only see half of your own skin pretty well.
That's a really good point. It's not like you're looking at, you know.
I'm glad. I wish I'd have known this 2 years ago. I got scars all over me from doing that. So I think this is absolutely wonderful.
Great finding.
It really is groundbreaking. Thank you so much for coming on the show. Please take advantage of this new technology. The Parker Clinic, 216-464-7333 in Beechwood, 440-946-9080 in Willoughby. Go to theparkerclinic.com for more information.
Thank you so much, doctor.
Thank you.
Okay, spring movie preview.